My name's Pat Stone. I'm the director of Columbia University's School of Nursing Center for Health Policy. Welcome to our bipartisan nurse state legislator, and we should have said an executive branch webinar. I want to start with expressing my gratitude to everybody that's come here out of their busy schedules and spent time to be here with us. We've had over almost 300 people, 299 people register for this event. And I just, wanted to thank you all. Some logistics. Both the chat and the Q&A functions are working. We'll be monitoring those. So, but please put your questions in the Q&A so they don't get lost in the chat. We've asked each of our panelists and moderator to introduce themselves. Their full bios will be put in the chat, so you'll have them. Each of our panelists have graciously agreed to use their first names, not their very respected and well-earned titles. So we'll be going by a first name basis. But anyway, so let's get started. And we're going to start with Darlene Curley, giving us a state of the state legislatures across the nation.
Thank you, Pat, and thank you to the Center for Health Policy for bringing these influential and powerful nurse legislators and those, again, in the executive branch together. I serve in the Maine State Legislature on Health and Human Services and Appropriations, and I've always been interested in the power and influence of nurses and how many were there exactly. We often talk about, we need more nurses in elected office. But then what was that number? So Dr. Stone and I, Pat Stone and I, did some research and audit of all of the nurse legislators serving, and we won out of 7,382 state legislators right now serving across the country. And on the federal side, let's start with that. Before we jump into the state, there were 3 nurse congresswomen right now serving in the federal government. There are none in the Senate. And so we're looking forward to that changing in the near future. If you could pull that slide up for me, please, of the nurse state legislators.
Of course.
Thank you, Bridget. So this is, there's a comparison here of the number of nurse state legislators in 2023 on the left-hand side, and on the right-hand side is 2025. And there are some really good trends, upward trends in the number of nurses serving in state legislatures. So Pat and I found, and again, the references are on the bottom here. So on the left-hand side is an article, Nurse State Legislators 2013 to 2023. So if any of you are using this data, please use those references. And on the right-hand side, 2025, it's coming from the National Conference of State Legislators. They're collecting information, and we only included registered nurses and retired registered nurses. There are certified nursing assistants and LPNs, but to make the data consistent, again, it's registered nurses and retired registered nurses. So let's just look at the trends, the numbers for a minute. 2023, we had 72 nurse legislators in states, and currently we have 86. It's a great increase. We've gone from 36 states to 40 states. And then I think we'll look at really the bottom of the slide, and that is the states that do not have any nurses serving currently. And that number has decreased from 14 states to 10 states. So we are making really great progress with the increase of nurse legislators. There's more interest, more nurses are running, there's more of a pipeline and focus. So with that, I will turn it over to our moderator, Ross Frommer.
Well, thank you, Darlene, and thank you everybody for joining us here today. My name is Ross Frommer. I am Vice President of Government Affairs at Columbia University Irving Medical Center. I also teach, I'm a lecturer in the School of Nursing. I want to thank our panelists. I also want to thank Patricia and Bridget and everybody from the Center for Health Policy at the Columbia University School of Nursing. We have three very distinguished guests with us today, all who are nurses and would like to have or have been elected officials. And rather than me trying to introduce them and messing it all up, I'm going to let them introduce themselves. And I'm going to start with my home state, Reyes. Karines, will you introduce yourself, please?
Sure. Great to be here, Ross. I'm Assemblymember Karines Reyes. I represent the 87th Assembly District in the Northeast Bronx of New York. I am a registered nurse. I've practiced in inpatient oncology. I still continue to practice as a per diem nurse. I chair the Puerto Rican Hispanic Task Force for the Assembly and the Senate in New York, and I serve on the committees of Health, Social Services, Labor, Alcoholism and Drug Abuse, and Aging.
Okay. Actually, Bethany, you're from the first state. I should have let you go first. I apologize. So second from the first state, Bethany Hall-Long from Delaware.
Thank you, Ross. No, hey, you've got to go to her first. Welcome all. I love the chat. Continue to chat. I am so thrilled to be here, having been a member of the legislative branch in Delaware for almost 16 years. I was a state representative, followed by a state senator, then served in the executive branch as lieutenant governor, and then most recently, though it was short term, the governor and the first nurse governor in the 50 states. So that was kind of unique and exciting. But really, we are thrilled to have the nurses here. We have some scholars, we have professors, we have frontline nurses and students listening today. And I will share with you my journey. We'll get into in a moment was simple. But right now I am on Act 3. I'm a professor emeritus, University of Delaware Nursing. And I have used that experience in the House, Senate, and executive side to really make an impact on many myriad of health issues that you'll hear about. And could never have done it without some great mentors. And hopefully we'll talk a little bit about that. And hopefully the three of us and Darlene and others will be mentees for many of you as well, and mentors to help you out. So it's great to be here.
Thank you, Bethany. And last but not least, from the great state of North Carolina, Gale Adcock.
Yes, thank you. Welcome to everyone for being here. I am Senator Gale Adcock in my second term in the North Carolina Senate, after 8 years in the North Carolina House and 7 years, which is 2 terms, on the Cary, North Carolina Town Council. I'm a family nurse practitioner. I spent the majority of my 38 years as a nurse practitioner in family practice, running a large family practice for an international corporation whose global headquarters is in Cary. I serve on health, HHS appropriations, commerce and insurance, state and local government, which is a love of mine, as well as health, and Senate calendar. It's called the Calendar Rules and Operations of the Senate. I'm the first nurse to ever serve in our state Senate and the first advanced practice nurse to ever serve in our 170-member General Assembly. I represent in the Senate 200,000 citizens in a mostly urban Western Wake County district.
Thank you. Thank you all. So Bethany touched on this list a little bit, but I want to start out by talking about your journey from healthcare expert, from clinician to elected official. How did you make that transition? Why did you decide to run for office in the first place? Maybe we'll go in reverse order. Gale, would you like to start?
Darn, I was hoping you wouldn't start with me. Okay, this is the biggest challenge for all of us. And I'm going to try to set the standard for being brief. Here's the great news. You don't have to stop being a nurse to be an elected official. It's a normal expansion of and extension of our role as advocate, educator, teacher. And so over the years, I think about 3 things that helped me to begin to believe that I could be an elected official as well as a practicing nurse practitioner. And that is joining my professional association, which has been crucial for my leadership development, my support group, the people who really have been visionary and have helped me to have vision, getting involved in local politics at the precinct level and getting my fingers and hands dirty by walking door to door, making phone calls, getting into that real local, state, and national campaigns. And then the other is community involvement, beyond healthcare. I call it your non-nursing resume. Being involved with community nonprofits like the YMCA and things like that, so that when I did decide that I would go to campaign school and, learn all those things I didn't know as a nurse to run for office, I had what I consider the three legs of the stool to make me a desirable, electable candidate.
Bethany?
Yeah, and Gale, that was great. To tag team on to what Gale stated, for myself, I've always been, was a hospital nurse, then into public health, population health, and serving vulnerable populations. And each of us has a different driver. But the one thing I bet all of us, including Darlene, is that we recognize the value of our professional associations and others, which inspired me. And some are not always nursing linked. League of Women Voters and others sometimes provide advocacy. And for me, I was on the streets, and I continue to practice now on the streets of giving medicine and care to the most vulnerable, mentally ill, homeless, substance use clients who need assistance. And that's what drove me. I saw if we weren't at the table, we're on the menu. So again, if nurses are not at the table, you're on the menu. Now, not everybody has to run for office. Letter writing, testimony, giving engagement. I saw that, and I crescendoed into that role of elected office. I was worried my persons in the community were not getting the service that they needed, the veterans. And I'll be very honest, if Diane Mason's listening in, her textbook in my graduate program kind of inspired me. Little did I know years later I'd be writing a vignette in that textbook. But sometimes we come to this journey, and for the nurses who are here today, great. For those of you who are in class who aren't here live with us today, maybe you haven't thought about public policy. I'll be honest with you, it wasn't something I initially thought of. But I soon discovered without the engagement, we are going to not have a voice. And so for me, I was able to get into the arena as a state rep, then a state senator, sponsored over 1,100 bills that impacted everything from cradle to grave, from healthcare to agriculture to the environment, and was able to really make that difference working with others. And nurses are great at that consensus piece. And so then I moved into the executive branch and able to really make a difference there as well in systems and continue to do that. So I want to be brief. I'd love to tell you more about the journey, but for those who are hesitant, please don't be afraid. And if you're tired, you're working night shift, your emails, your phone calls, they will make a difference, and get behind those candidates that you care about. So I'll stop there.
Thanks. Karines?
Sure. And I will piggyback off of Gale and Bethany. I think my I became politically active through my nurses union, my professional organization, because we were advocating at the time. We had a huge fight in the state of New York about nurse to patient ratios, and we wanted to create that and put that into statute. And that's how I became politically active. We were also fighting for single payer healthcare in the state of New York. It's a fight that we continue to have. And all of those kind of started to exercise my political muscle. And at that time, I ran to be a rep for my union, to bargain with management about nurse to patient ratios in the facility where I worked. And that led me to testify before the state legislature, to testify before my community boards, to become more politically involved. And when a seat opened up in my district, I think the local party already kind of knew me as a pot stirrer and a troublemaker, and somebody who was very vocal about the health outcomes in my community. The community I represent in the Southeast Bronx has the worst outcomes in any county in the state of New York. And I know that a lot of that is because of health policies that aren't driven by the experiences of community members. So I wanted to be that voice, and I was asked to run. And like most women, when they get asked to run, they say, no, I'm not interested. And I had to be asked multiple times, but it has really been the honor of my life to be able to serve my community in this capacity. And that's how I became politically active. And I think folks should get more involved in local community organizations, local community politics, because all politics really are local. And these are the decision makers that can impact the daily lives of people that we represent.
Thanks. Tell me about your first campaign. What was it like getting out there, talking to people, making your first speech in front of a large audience, taping your first commercial or editing your first newsletter. What were the challenges you faced? How did you overcome those challenges? How did you sort of stick that big toe, then the ankle, then the full leg in the water, if you will?
Should I? Who's
Sure,
going first?
sure. We'll go, whoever wants to, shall we say. Karines.
I'll be brief. I wasn't a great public speaker, and I was afraid to go off the cuff, right? Because I think there were so many things I wanted to say, and I wanted to make sure I said them and I said them correctly, and language matters and how we say things matter. So I remember my first speech when I did my campaign kickoff, I was kind of like writing everything down, and I read from it. And that of course has evolved into me, you know, doing bullet points and then kind of expanding on those things. But one of the things that I really enjoyed about my campaign, because where I practice is in my community, and because I hadn't run for office before, a lot of people said, you know, you don't have name recognition, it's going to be a challenge. But what I found as I was knocking on doors, as I was standing at the train station every morning at 6 a.m., talking to voters and talking to my neighbors, that so many people recognize me from the bedside. And even though I practice in a specialty that not everybody necessarily interacts with in oncology, I found that a lot of the people that I spoke to either remembered me as being, you know, their family member's nurse, their mom's nurse, their sister's nurse, somebody who they've encountered in the hospital setting, and they remember how I made them feel as a bedside nurse. And trusted that I would bring that type of caring and that level of caring to the job as a legislator. So that was my experience, and it was really humbling to be able to connect with people on a different level in a different setting with the work that I was doing as a nurse.
Bethany or Gale, would you like add anything?
Yeah, I'll jump in. Looks like Gale wanted me to go. We'll go round robin. How's that, ladies?
Okay.
I will tell you, my first election, I didn't win. I ran as a state representative against an incumbent, and I've been on bookends, right? I lost at the last governor's race. I know winning, losing campaigns, but that first campaign, you are nervous. However, I would encourage those contemplating whether you're going to run for a state house, a school board, put your feet in, jump in, and go for it. I know that the fundraising is always an issue. We could talk about that separately, but those first races at the doors, really, as Karines said, it's really, truly taking your passion and giving it voice. Folks, we are the #1 profession trusted by the Gallup poll in America. They love nurses. Every door you go to, when you tell them you're a nurse, people connect immediately to you. And I know our country right now is so divided, but people love nurses. We all bleed red. And I will tell you that first election has changed. Okay. It was 25 years ago. My first door I knocked at, the person said, "Oh, it's so nice that you're helping your husband." I'm like, "Husband? I'm running." So times have changed a little bit. And the issue is that the issues evolve as well. You know, my first election, the issues were probably focused around some preservation, land development, ag, economics. Now today, very much on economics, innovation, technology, making places the best place for families to live, work, and grow. And so we evolve. Nurses are the best at this. You know how to listen. You have 2 ears and 1 mouth. Nurses know exactly what to say. And even though you may be nervous in those first debates and with conversation, we really are so prepared. So if you're sitting on the fence listening in today, don't be afraid. And there's associations and others that will work with you. And I encourage you to take that leap like I had to take the leap, just like all of us here did in that first election. And so I hope that every one of us, as we speak today, those of you who are sitting on the edge of your seat, not quite sure if you're going to take that leap, we really hope you do.
What I would add to what's already been said is that being a member of your professional association or associations and groups outside of that, whether that's Toastmasters, League of Women Voters, whatever, are a wonderful opportunity to develop your public speaking skills, your ability to think on your feet, and kind of your rapport with the audience. So I had that going for me, as I'm sure everyone on this panel and many of you, if not all of you listening today have had. So take squeeze every penny of your dues money and demand that media training and all opportunities for that professional development where you get the opportunity to speak in front of so many groups that by the time you're doing it in a campaign, it feels like your average Tuesday, right? Then add to that, I cannot more strongly recommend you go to campaign training, whether that's a campaign school like the Healing Politics Campaign School for Nurses and Midwives, or whatever campaign school is more accessible to you wherever you live, whether that's party sponsored or it's nonpartisan. There are things we know how to do as nurses, like instant rapport with an audience, giving a straight answer, right? Not giving an answer goes all around your elbow to get to your thumb kind of thing. But there are also things that you do not know how to do until you either trying to learn to do them in the middle of a campaign. I do not advise that. Or you learn and practice in advance, because that's what will give you the confidence. And I can tell the difference in a candidate who has had campaign training and one who has not. Number one, they're not so stressed out because they know what to expect and they know kind of what the job is, and they have a plan and they work the plan. So by the time I ran for local government, which by the way was 18 years ago, I'm in my 18th year in office, certainly not a candle to Bethany's long years. But I felt prepared to go forth. Certain experiences were new and different, and maybe my heart, sped up a bit, but I didn't feel unprepared. With each, I've had 8 campaigns now, getting ready to have a 9th. Each one of those, you get your sea legs a little better. Some things, it's like putting in your first IV. The first time you did it, your hand shook, you were nervous, you probably missed the vein if you were like me. But by the time you do the 10th one, it's like old hat, right? You're done. That's how campaigning is. The more you do it, the better you get. So I also learned to give myself grace, that I was not going to do everything perfectly, that I was going to, occasionally flub up an answer, or occasionally, not have a great, well thought out answer on the front end, or be too tired to go to something. I was going to be able to give myself grace, give others grace. And you know what I found out is that your voters, your constituents, the people who are at these events, they like to see that human side of you. They don't want to see somebody who's so slick and polished that they think they need batteries, right? They want to see someone who looks and acts and speaks real. So I would say to you, just like Bethany and just like Karines has said, we've done this or are doing this. You can too. Should you prepare for it? Sure. I'm a big believer this is not the place for OJT, but you're capable of doing it if you have the interest and desire to do it. Consider yourself asked.
Quick question. All else being equal, being a nurse gets you votes, cost you votes, or not really matter in an election?
So I'm going to start. I'm going to say it's always got me votes. People like nurses, trust, okay, but everybody has a good feeling about nurses. When I would knock on someone's door and say, "Hi, I'm Gale Adcock. I'm your neighbor. I'm a registered nurse and a nurse practitioner," immediately I could see people's defenses go down. So I just don't think that was ever a turnoff. Now, I also say nurses can help you get elected. You need nurses in your corner. You can't do it without nurses, but you can't do it only with nurses. I feel this way about all professionals. If your own professional peers do not support you, that says something about you. So that's important. But I would say for me, it has been a plus in running, and it has been a plus in serving.
I couldn't agree more with Gale. It's definitely been, I think it adds votes. It helps you gain votes. But nurses have, we function through therapeutic communication. And when you are communicating with your constituents, you're talking to your neighbors, I think nurses have a demeanor. We have a certain amount of poise. I think that we don't necessarily live in gray areas where I think sometimes when people see traditional politicians, they tend to overpromise. They aren't as clear. They don't stake their ground on certain positions. But I think nurses inherently, because of the work that we do, are very honest. And it's why we're one of the most trusted professions. And I think people find that refreshing in politics when you come to their door and you're talking to them and you're clear and you're concise and you talk to them with truth. And politics needs more of that.
Great.
Amen, sister.
Oh, yeah, that's great. And I would say, to whether you're Columbia University, another university listening in today, thank you for hosting this, because we need to educate students to understand that nursing is indeed a real plus if someone is going to run for office, whether at a local level, a higher level, it matters. And as Darlene indicated, those indicators with more nurse legislators, 86 now, I think you said, Darlene, but that's out of several thousands at just the state level. And so we need to have that, because again, Gallup poll, we are the #1 trusted profession. I easily, every door I hit, because campaigning 101, people love telling you stories. They trust the nurse, just like Gale. I go to the door. Hi, I'm Bethany. I'm not selling anything. I'm a nurse. Oh, you're a nurse? Look at this sore on my mouth. Are you doing this? How are you? People love nurses. Now, the area we have to be cautious of is making sure our colleagues in the policy arena don't think we only know healthcare. We know a lot about economics. We know a lot about ag and environment and justice and other policy areas. So we have to make sure when we're in debates with others who maybe be running against us politically, that they also recognize that this nurse understands broad policy and economics as well. And so I am delighted that you asked that question. And I think all of us here today hope that those who are on that seat waffling about running, or help a nurse. If you don't want to run yourself, as Gale said, get behind those nurses and help them with campaigning, financing, messaging, however you can help.
Can I add this to what Bethany just said? It's really important that you don't run solely as a nurse. Nursing is the foundation, but you have to know, you have to be as well-rounded and as informed and conversant as every other candidate. You've got to be able to talk about education, economic development, environmental protection, whatever the issues are in your area. You best be prepared to do that, because you can't. You're not going to be able to only vote on the healthcare issues. Actually, there's health in all policies, which is a nationwide view. But that said, yes, everybody wants to vote for a well-rounded 360-degree candidate.
So switching from nurses as candidates to nurses as legislators, congratulations. You've won, you've been sworn in, you're starting your career. And you touched on this a little bit, but does being a nurse sort of help you get certain committee assignments? Do you find yourself being pigeonholed on healthcare issues? Is that a good thing or is it a bad thing? Just curious, how do your colleagues view you when you first walk in the door?
Yeah, when I was first elected, I had advocated and asked for the assignment of the health committee, and I actually wasn't given. I wasn't assigned to the health committee on my first term, and I to me it was such a slap in the face. I was like, why would you not have the nurse on the health committee, right? And the speaker said to me, well, I'm a finance major, and I didn't get Ways and Means they consider it a much senior position. So I don't feel like I was pigeonholed on health issues. What I did find was that my colleagues rely heavily on my opinion when it comes to health issues. And to Gale's point, you have to be very well versed in other topics. And I think also the work that we do as nurses expose us to the reality that people face, the economic issues, the reality of when you're unemployed, underemployed, unhoused. All of those, we see all of those socioeconomic issues play out every day in our role as nurses. So I think because of the work that we do, we are very well versed on other issues as well. But what I have found is that my colleagues rely very heavily on my opinion when it comes to health policy. I think that they value my opinion, and I happen to not be the only nurse in the legislature. There's two of us. In a body of 150. But I think that's great. And I've made sure in my work to not only talk about health issues, and I've sponsored, dozens of bills that range from different topics, and have worked really hard to make sure that I'm not just characterized as the person who only talks about health.
Yeah, excellent point. Interestingly, for different reasons, I was when I was elected to the legislature 11 years ago, I was not appointed to health either, but the reasons were because I had beaten an incumbent in the other party, and his parting request to the Speaker of the House was not to put Adcock on health because he was a pharmacist and a JD, and he didn't want me to have, a pulpit on the health committee. So that was my number one choice, in addition to local government, commerce, things like that. So I went to the Speaker of the House and had a conversation with him and, humbled myself and told him that I wanted, I'd like to serve on health at his pleasure. And he did. He told me the story about why I wasn't on health to start with. But he did put me on health. He did appoint me 2 weeks later. Karines, you're absolutely correct. You can't just know about health. I will say, however, that, and I bet you do this too, and I'm sure Bethany did, is I use a lot of clinical examples when I try to explain something in transportation or education or government, because people know I've been a nurse practitioner for 38 years. And when I use that analogy, they go, she's coming from a place of knowledge. And as Karines said, yes, I'm looked at as the healthcare expert by both the members of my own caucus, that's 20 of us, and the 30 members of the Republican caucus who are in the super majority, because it's, as I say in the 50-member Senate, it's 49 well-intentioned amateurs and me, because they mean well. They mean well. They just don't know anything. And so it's my job to gently, just like we would with our patient who's doing something, what you want to say is, oh my God, you're not doing that, right? But what you say is, wow, tell me how you came to that decision. Tell me more about that, right? As they come to me and say, would you look at my bill? The chair of the health committee sent me his midwifery bill and said, would you read my bill? And would you consider co-sponsoring it? So I read his bill, and it was written terribly. Good intention. It was not going to do what he wanted it to do. And I said, how much help do you want? He said, all the help you'll give me. I rewrote his bill for him. I gave it to him, and I told him I couldn't co-sponsor it. There were some political reasons for that. But I said, I don't care about having my name on your bill, Jim, but I'm happy to have my fingerprints on it. And you don't have to tell anybody I wrote this bill for you. I mean, that's how it works.
That is how it works. The blending of policy and politics. I could listen to Gale and Karines all day. I would love to add to this that, yes, being a nurse, helps certainly to get on some of those natural health committees. But people do revere us for the science and the data and our knowledge. And for those listening in, our faculty, gosh, didn't you not hear in Gale and Karines' answers? I did. Kind of the application of the nursing process. Believe it or not, we break down issues. We pull apart. We come up with an implementation plan. We are natural policy makers. We know how to listen. Gale did reflective skill set when she asked that legislator, tell me how you came to this. Those are the skills I also have used, and being a nurse has made a difference on those committees. Let me give you a couple more thoughts from an executive branch side. So there's a legislative side, and nurses on the executive side as a legislator, and then a lieutenant governor and governor. I oversaw the census for the state. I oversaw the reform of the pardons board justice system, overseeing and creating the first behavioral health system, overdose system of first in America, overdose system of care, leading the opioid crisis. Also being assigned the pandemic resurgence, having to oversee COVID. Nurses, that's where some of the science comes in, some of the human behavioral understanding. So behavioral health, physical health. And those are areas where we do make a difference. And again, if you're not the elected official, serving on committees, getting on your governor's commissions are really important. So just have to keep putting those little tidbits in as we go.
Yes, we can never forget the executive branch.
Yeah.
Looking on your career in elective office, what would you consider sort of your biggest success, be it in healthcare arena or in anything else, any other policy arena? It's an open-ended question, but I hope you can come with some.
I'll jump in real quick since I think we're doing round robin. Last to speak, we'll go first. We're all taking turns. I mean, for me, it was the marriage, particularly of the academicians online. As a tenured professor, it's been really important to me to combine my academic opportunities with my students and the mentoring, whether working in the community on the ground with substance use disorder. Every week I go out as an undercover lieutenant governor, and blending that. My doctoral student, some of you knew Ron Costado, advanced practice registered nurse, CRNA, utilized his dissertation to do the first round in our state of Delaware, where now a speaker is a nurse in the state of Delaware, Speaker Meyer Brown. She finished for me the advanced practice registered nurse legislation that I gave independent practice. Shout out to some of my APRNs who were part of that online today. But those are some of the things I am most proud of, as being able to utilize our skill set to merge. And I could go on for hours on some of the legislation. I was so blessed to work with many organizations to change, whether environmental health, to behavioral health, to education, through legislative processes. How insurance occurs, mental health parity. I mean, there are so many things nurses do. And then you've got to get involved, whether you run or you write letters or you get engaged. Because if not, again, you are on the menu if you're not at that table. And so for me, it's being able to mentor, to bring along, and to merge some of that academic work with policy.
So the flip side of that question, I'll try to, sort of a positive spin. What is the goal you have not yet achieved? And perhaps Karines and Gale, still in office, may want to focus on this. What's left to accomplish?
I'll go. And Bethany just actually brought something to mind. One of the things that I've been working on is a CRNA bill, a scope of practice bill, to recognize the profession in the state of New York. We've been working really hard, but New York has been historically infamous for not doing scope of practice bills. And the way I approach this legislation, not just as a registered nurse who is trying to advocate for the profession of nursing and advanced practice nurses, but as a cost-saving measure for healthcare in New York, when we are facing federal cuts, a huge Medicaid deficit. And one of the ways that we can kind of merge that gap and meet our goals and continue to provide safe, affordable, and adequate care is to have advanced practice nurses, become more independent in their practice. And it's a huge fight that we have in New York because historically it's not something that we do. I think New York prides themselves in being a little bit very difficult in that sense, but that's something that I'm working on, and I hope that this is the year, given all the federal pressures.
That would be great. Well, I'm going to answer both of those questions very quickly. The first question was, what are you proud of? And what I would say is, I think I have helped to change the narrative, first in the House and now in the Senate, to have more provider neutral language put into bills. Because what I know from having served on the Board of Nursing for 2 terms, and what I know from having advocated for more than 25 years as a grassroots lobbyist in the General Assembly, is once that bill's written and it says physicians, that's how it's interpreted, even if that's not what it meant. If the people who wrote it used physician thinking that was some generic term and that later it would apply to everybody, and now you got to try to change it, yeah, good luck with that. And so I have made it my cause to every bill I read, whether it's labeled health or not, and it says physician, that it actually means physician, because there are times when that's the word to use. And there are times when that is not the word to use, when it should say healthcare provider, or it should laundry list. There are times for that too. And so I make that a priority. What I've not been able to achieve so far, me, and not just me, but a wonderful team of both other nurses in our legislature. We have actually 4 nurses in our House, just the one, me, in the Senate. We've been working on APRN bills, so all APRNs, full practice authority. We have a wonderful coalition of our nurse practitioners, certified nurse midwives, our CRNAs, and our CNSs, and we're going to do an omnibus bill for scope of practice. And yes, it is a harder road to go, but that I always tell my folks, hard doesn't make it wrong. We all have different reasons, but we all have compelling reasons for which our scope of practice needs to be codified, and we need to get, our nurse practitioners and midwives, we need to eliminate physician supervision that's, it was barely workable in the mid-70s when it was first established, and it's totally unworkable and unsustainable now. And so that we have not gotten that bill across the finish line yet, but like a football game, we have marched down the field. We've made first down after first down after first down. We've done everything to get it across the goal line. So that's something that I want to get done before I leave this joint. And I'm dedicated to that.
So, Gail, I should have said this before, but I'm a New York Jet fan, so football analogies are not allowed in this webinar. Not a good
Just
weekend.
like we don't use baseball analogies if we're talking about the Cubs, right? My husband's a Cubs fan, I can say that.
I should have mentioned earlier, if you have questions, please feel free to put them in the chat or the Q&A section. We will try to get to them a couple of minutes towards the end. When we were chatting before the webinar started, we were talking about this earlier, but do any of you have interesting stories, if you will, of time that you've actually got to provide health care to a colleague or someone in the state capitol in need, an emergency situation where you stepped in and got to use your clinical skills in the political setting?
Okay, I'm going first on this one.
Okay.
So when I was a freshman, honey, I was still green, figuring out where the bathrooms were. I was at a reception one night, and I was grabbed by the staff of the Speaker in the House to walk across the legislative complex to take care of a member of the majority party who was sitting outside this big meeting room having a full-blown panic attack. His panic attack was a result of a physical issue he was having, though. And so I really didn't know this member very well yet, knew my name. And so I assessed the situation, ended up sending him to urgent care where his physical condition was taken care of, and his panic, of course, he had medication for that, and that got all better. So the next day, he gets up on the floor. He comes over and thanks me personally, but at the end of the session, he gets up and asks for recognition by the Speaker, and he calls me out and says, Representative Adcock came to me in my hour of need. She didn't ask me if I was a Democrat or Republican. She didn't care. She helped me, and, went on and on, spread across the journal, blah, blah. the following week, he comes over to me and he says, Gale, would you like to be on this bill with me? Now, remember, I was a freshman in the super minority party who had beaten an incumbent, and everybody was supposed to hate me. And I said, well, Charles, let me read the bill. So I did. It was a great bill. It was a bill about screening newborn, adding severe combined immunodeficiency to our screening test for newborns, because it's fatal if it's not picked up and the child doesn't get a bone marrow transplant. So yes, I said yes. And that bill ended up getting through the House third time it had two other times where it wasn't successful, got out of our chamber, into the Senate, became law. I was the only other bill sponsor invited to the bill signing. And that's not supposed to happen when you're a freshman in my state anyway. And the mother who was handed the pen by the governor, who he signed the bill with a bunch of pens. He handed her one. She walked across this huge room in front of all the press and everybody, gave me her pen and said, thank you. That stuff doesn't happen. You can't make this stuff up. And that was because I was there at the right time with the right attitude and the right skills, and I took care of him. And I'll never forget that. And that was 11 years ago.
It's a great story. Bethany, Karines, anything similar along those lines?
Sure. I don't know. Corinne, do you want to go, or me? It's up to you.
You can go, Bethany.
I'll go quick. I have so many. I've been around 25 years. I could tell you about every event when it's hot and parades and people passing out, but a couple stand out. I was able to administer CPR and revive someone who was pauseless at a parade. I did that also at an IMAC church service, jumped over legislators and somebody went down. But, and I think all of us as legislators and nurses, people pull you aside. Hey, can you take a look at this? Can you this? So all of us, Gale's story is remarkable because it shows how those relationships as nurses are trusted. People will tell you the most confidential. And in the Legislative Hall of Delaware, I know people, some of their most private health issues would stay private. And then some would choose to share those. But one that's kind of cute, not quite like Gale's, but a cute story that I never envisioned. I was a brand new also in the House, was over and somebody collapsed in the Senate. I went running over, anticipating it was one of the older colleagues. It was not. It was at then a 40-some-year-old healthy lieutenant governor who had gone down with a serious, we thought, heart issue, but later turned out to be more inner ear issue. Ended up going on the ride with this person. He threw up all over me. Little did I know, 20 years later, no, 15 years later, I would be running as his lieutenant governor when he became governor, and I would be serving with him. So you never know who throws up on you. You might serve in a higher office, but kind of a cute story. So I think, everywhere we go, nurses do make a huge difference, and we are trusted. And it does build relationships. Not that it'd make you end up being a lieutenant governor with the governor, but that is kind of a cute story.
Yeah, I mean, I have tons of stories as well, but in our state capitol, we do have in-house nurses that kind of respond. We had a visitor go down in the back of the chamber by the elevators who needed to be resuscitated. I wasn't around, but everybody was looking for me. And only because of that incident did we then start to train everybody else in the staff as to where all the AEDs were, because I think folks only thought that there was one inside the chambers, but we actually had them throughout the Capitol, and it was kind of like a scavenger hunt for everybody to know where the AEDs were in case of an emergency. But more recently, I was at a community event at the service for Officer Islam, who was shot during that NFL situation downtown in Manhattan, who was a constituent. And we had a service, with all of the ranks of our police department and our law enforcement. It was a very, very long service, and we had 2 police officers actually pass out on the line, and I had to respond on the in a moment's time, but they were both just hypoglycemic from kind of being in the uniform, hot, rainy, not eating all day. But just a few examples of where my skills have come to use.
I guess a follow-up question, flip side. Have you ever had patients or people you've seen in the clinical setting try to lobby you or discuss policy issues because they know of your side gig, if you will, or not side gig, but your other responsibilities?
All the time.
All the time.
Does that get awkward, or how do you keep them focused on your?
Hey, listen, when I was still in clinical practice, and I was in family practice, and I still saw patients as well as ran the practice. And my patients, I'd come in the room and give my patient a hug, and they'd say, "Yeah, what about that bill?" Da da da. I said, "Look, Mary," I said, "this visit is all about you. Tell you what, let's take care of what you're here for today. If we have any time left over and you want to talk about that, that's fine. Or I'll have a cup of coffee with you off campus sometime, whatever you want to do. But right now we're here to talk about you." That worked every time. Yeah, there are a lot of and then I've had former patients of mine who've come to the General Assembly with part of an advocacy group who come in to talk with me about an issue. It's really it's a cool full circle moment.
Yeah, I mean, for me, when those days where I am on the floor and I'm working and they recognize me, sometimes they do, sometimes they don't, because I have my hair pulled back and I'm in my scrubs, and they'll ask me like, are you Miss Reyes? And it's like, yes, I am. And then they'll usually talk to me about some constituent issue. It might be housing related. It might be insurance related. And at that point, what I'll do is I assess, and then I make sure they get an appointment with my constituent service staff, once they have an opportunity to do so.
So what a healthy balance, right? And I love it in the chat. We're talking school nurses of legislative bodies. I love the chat. I'm reading all of that. And I agree. You hear this healthy balance where Gale, who's providing as an MP, her structured, remark that is professional, but hey, we're focused on you. But then when they came to her, they listened, just like with Karina. Karina listens, you make referrals, whether it's housing, car insurance, you name it. It could be all kinds of things, or bills. I get a lot because I'm out in the public, in the community, on the streets, and I love sometimes getting their feedback because I was in the front lines of the opioid epidemic, and it was really important that we were one of the states to get Narcan out on the streets, that I had made sure that fentanyl testing strips were combined with xylazine that were created because those clients, because of where we are. So I think as nurses, where we are will depend on how we respond with those scenarios, because sometimes it's just not appropriate, but other times we want their feedback at that moment.
One final question before we get to some of the questions that have been put in the chat. And Bethany, I'm going to direct this towards you now that you're back or continue to be in academia. Do you find that nursing students are interested in policy and advocacy? How can nursing schools better incorporate that as part of the curriculum?
I think that, well, I know it's happening. I see some of the folks who are absolutely here and absolutely seeing that shift. And I know that having real lived experience, whether through clinical or courses in policy, can make such a huge difference. And there are population courses, political courses where people can be nonpartisan. And I know nurses are making a huge difference. And knowing some of those who are here today from some of the other institutions like Columbia and others, who are doing this also with undergraduate, just not their graduate students, used to be just graduates. I'm just so proud that they're doing that. So aligning them, getting clinical opportunities, bringing them to the state capitol, working with their nurse associations, their professional societies, teaching them how to write letters, to not be afraid, how to engage. Again, complaining about something does no good. Coming up with solutions is what we want. We as nurses come up with solutions. We're not private investigators. We're not lawyers who look for problems. Nurses look for solutions, and that's where we have to teach our students.
Oh, great. Thank you. Pat has rejoined us, as is Darlene. So a couple of questions I've seen in the chat. I'm going to start out with one, sort of a nuts and bolts question, but how did you finance your campaign? I've heard, this is Ruth Masterson Kreber. Apologize if I'm not pronouncing your name correctly. I've heard about a $200 million campaign to run for the Senate. Just curious, how did you raise money for your first election or your subsequent elections?
Every campaign's won with other people's money. And those are individuals or PACs, whatever, the campaign finance rules are in your state. In my first House race, I raised $250,000 by myself. And as I tell my husband, my second husband, I keep marrying for love and not money, which means I have to have a lot of call time. I got to call people up and say, would you invest in this work that I want to do? And so I raised $250,000. My caucus put in $250,000 of in-kind in mail consultants, 17 pieces of direct mail and 2 TV ads for $500,000 on my side of the equation. My opponent, who was the incumbent, he and his caucus spent $600,000. So that was a $1.1 million raise in 2014 to get this, my salary is $14,000 a year as a legislator. So what I would say to you is it depends. There are some districts in which you could probably run a race with $30,000, $40,000 or less. Others, it costs way more than the money that was spent in my race, especially these days. I'm always aware that was 11 years ago, that same race, if it was that tough, my race in 2014, of the 120 House seats, was the most competitive House race in the state that year. That's why it cost that much money then. I'm sure it would cost more than that now. I'm sure Bethany and Karines have similar stories to tell.
Well, I think my first raise, I raised about $150,000. That was for the primary and the general. And in New York, we have closed primaries. So the real race is the primary. By the point you get to the general race, it's not really a race. I did have like a conservative and a Green Party candidate running against me. But at that point, I think I won 94% of the vote. But in the primary, it was a 4-way race for an open seat. So, I think it was a significant amount of money. And, you raise the money from your neighbors. But I think overwhelmingly for me, what helped me raise money was labor. Because I was a labor candidate, I was a dues-paying member of my nurses union. I was somebody who was active in the labor movement, and labor really came out to support me both in direct contributions to my campaign, member contributions to my campaign, but they also did independent expenditures for me, like they mailed out to their members as well. So I think that's what helped me push me over the edge.
And all I'll say is don't be afraid of the money. Don't be afraid to ask or get help. And every seat's going to be different. And you'll follow your state guidelines. And as Karina, myself, when I ran for governor at Port, labor was a huge component and very supportive and very helpful. And as Gale indicated, call time, letter writing, it's not an easy thing to do. However, it's feasible. And working, if you are a volunteer, maybe you'll donate some time, or maybe you'll donate to a campaign for a candidate that you believe in. So again, campaign finance can be seen as a problem, but it's also a great opportunity. You'll learn a lot about the policy issues as well. And, sometimes, I had the experience this time. My last race, my opponent had big PACs because they're Citizens United. They were able to give unlimited money. It was like 10 times the amount I was able to raise, even though I'd raised a couple million. So again, it's a matter of understanding the position, knowing the race, and just don't be afraid. Don't be afraid about the money.
Let me add this. I just see the question Stephen has in the chat about federal campaign finance reform. That'd be great for congressional seats and U.S. Senate seats, but campaign finance laws are state by state.
Yeah.
So if you don't like the way campaign finance law is written in your state, Stephen, I forget where you're from, then that's where you need to make that change.
Yeah.
You've seen one campaign finance law in the state, you've seen one. They are so different. It's all over the map.
Right.
So anyway, I just felt like that was important.
Yeah, and that's important to mention that. Now there is some rebuttal with the Citizens United, but that's a whole nother thing.
Well, that dark money, that's different, of course. But I'm talking about the rules about, who can give and how much and when, and whether you can give pre and post primary and all that other stuff. Where the corporations can give. Some states say yes, my state says no. Yeah.
And we have a public matching system now that started as of the last cycle, which is new in New York when we changed our campaign finance laws as well.
Yeah.
So for people who want to raise from their neighbors, that money is matched 10 to 1 in the state.
So I want to bring up a question because it says it's answered in the Q&A. My only answer was I'll ask it in the last 10 minutes. And it's from Susan Engel, and she says, what happens when a bill is presented that you think it's going to hurt your constituents and does not support sort of the code of ethics of nursing, but you're pressured to vote the party line? Gale, you sort of got to that on the nurse midwifery bill, but maybe others have some thoughts on that. Has anything like that ever happened?
I've not had one where I felt my ethical code was being violated, but I've definitely seen some bills that I knew were not, they were not based in science, and they were not going to help anybody, much less I represent 200,000 people, but I have to make decisions that affect 11 million people in my state. And so I look at that, and we have a little mantra down here: vote your conscience, vote your constituents, and then vote your caucus. My caucus is always last because they're not the ones who sent me here, and they're not the ones I'm responsible to. Now, that said, I try to be a good caucus member, but there are many times where I've voted my conscience and I've said to my caucus leadership, I'm going to help you understand where I'm coming from, and I'd like to have your understanding, but I don't have to have it. Because what I've got to do is be able to go back into my district and explain to the folks I see at the grocery store in the park why I voted the way I did.
Can I make that question a little bit more difficult?
Sure.
Your constituents clearly think A, but your training as a nurse, as a scientist, makes you think that B is the correct answer. How do you handle those situations?
Get ahead of your message. If I'm going to take a vote that I think is going to upset, say, a group that has supported me, and I did, and the reason I say this and believe it's true is because I haven't done it. I didn't do it as a freshman, and I learned my lesson big. And that is, when you're going to disappoint people with your vote, they think it should be one way, and you believe in your heart it should be another. You just need to tell them first. And again, because nobody likes being surprised and disappointed as a surprise. And people still may not be happy. And many of the conversations I've had with constituents who've not been happy with the vote is they come to this on their own, is they look at my body of work and they go, I'm not happy about this vote. On balance, though, the rest of what you're doing down there, I agree with. And so we're going to agree to disagree. This is how I've had that conversation many, many times with people. And they come to that themselves. They don't throw the baby out with the bathwater kind of thing.
Well, anybody, one last minute. We are at the top of the hour in 1 minute. Last thoughts from anybody?
I would just say, to Gale's point, you sometimes you just have to educate people and get ahead of the messaging. I think of all the polarizing conversations that happened during COVID around mask mandates, vaccines. We know masks work. We know masks are meant to prevent the spread of disease, and prevent people from getting sick. And people will want to debate you on the merits of wearing a mask, something as simple as that. And and people want to debate you on the merits of whether vaccines actually work or they don't. And we know they do historically, and the science is there. But that's unfortunately the debates that we're having today that I thought weren't debatable anymore. But I guess that's not the world we live in.
Bethany, do you have any last comments?
No, and all I will add is, don't be on the sidelines. Please get in the arena. As for faculty, thank you for encouraging your students, for their doctoral students, to answer a question that was in the chat. There's so many ways to take your evidence and your research and take it into legislative caucuses, into bills, or into regulations, because there's the whole executive side. Serve on commissions. Find out in your state. They need bodies are open for hearings, for education. Sign up, be engaged, be involved. And again, those policy issues, I never put my head to the pillow on a policy issue. I had to make sure I could sleep on that. And there are conflicts that happen all the time. Ladies and gentlemen, it is up to us in America to help keep us united. I don't care whether you have an R or a D after your name right now. We unify people, and nurses are the voice, I am convinced, that is a solid foundation. So I've been thrilled to be here today. Thank you, Columbia, for having me.
I would just say we could do another webinar just about how to translate research into policy, because that is actually a deep conversation. That's worth the work. And I would suggest that perhaps there's another venue for that sometime, because that's something I'm quite interested in.
That sounds like a wonderful webinar for us to sponsor next year. I want to thank all of our presenters, our moderators. This is a really exciting and informative event. As well as I want to thank all of you from across the nation. And from the chat, it's clear that you have different experiences and different goals. So thank you for the time to hear this webinar live. I want to remind you that the recording's available on the Center for Health Policy webpage in a few days. It takes us a few days to get there. And you can also access the other webinars we've sponsored. Last, but certainly not least, I want to thank Bridget Morris-Carazon, who's our manager at the Center for Health Policy, and she's kept us organized throughout all of this. So thank you all, and I'm sorry we only had an hour for this.
No kidding. Somebody saved the chat. I'd love to read it, because
Yes.
I can't, I needed to stay in the moment, so I couldn't read the chat much.
Okay.
Will do.
Thank you all. Bye-bye.
Take
Thank you,
care.
everyone.
Have a good day, everybody. Happy New
Bye,
Year.
y'all.
Thank you.